Have you suffered from lower back pain for years, only to be told your scans show nothing wrong? You've tried countless treatments with no improvement. You're not alone. 15 to 20% of adults experience chronic lower back pain, most classified as non-specific, meaning no structural cause can be identified. But here's the crucial question. Is there really nothing wrong? Recent research reveals something remarkable. Chronic lower back pain is deeply connected to how your brain works. It's a scientifically explainable phenomenon involving central sensitization, pain memory, fear-avoidance behavior, and brain relearning. Pain often persists not because something is broken, but because your brain perceives it that way. Pain is a sensation created by your brain. Brain imaging studies show that during pain episodes, not only sensory areas activate, but also regions involved in emotion and memory. Once you experience severe pain, that memory becomes encoded. Your brain predicts pain will occur again and actually generates it. This is called pain memory reconsolidation, where the brain repeatedly replays learned pain patterns. Central sensitization is when your nervous system becomes hypersensitive to pain. Neural circuits become easily excitable after repeated stimulation, causing weak stimuli to be perceived as strong pain. This occurs through neuroplasticity, the brain's ability to change. Once these hypersensitive circuits form, they become fixed over time, and pain persists long after the body has healed. Threatening experiences get stored in emotional regions like the amygdala, creating anticipatory anxiety that maintains pain circuits in a vicious cycle. Research shows chronic pain patients exhibit actual brain structure changes, including decreased gray matter in the prefrontal cortex and overactivity in regions linked to pain memory, anxiety, and depression. Chronic lower back pain isn't simply a musculoskeletal problem, but a neurophysiological issue where the brain's state has changed. A common characteristic is excessive fear of pain. This anticipatory anxiety creates behavioral restrictions, which decrease physical function, creating a vicious cycle explained by the fear-avoidance model. Pain experience leads to fear, which leads to avoidance of activity, resulting in decreased strength and confidence, which worsens pain, leading to more fear and depression. It's not the pain itself, but the attitude toward pain that contributes to chronification. Those with stronger fear-avoidance thinking have greater daily restrictions and longer pain duration. Catastrophizing, making extreme negative predictions, increases activity in brain regions involved in emotional pain, processing, affecting actual pain intensity. Research shows brain activity is stronger when people predict something might hurt than when actual force is applied. This predictive anxiety strengthens behavioral restrictions and worsens pain. The key is not the pain itself, but how you think about pain. Overcoming fear. Avoidance thinking requires developing new cognitions, that it's okay to move, and this pain doesn't mean damage, supported by behavioral experiences. Combining cognitive behavioral therapy with exercise. Therapy is extremely effective. CBT was originally used for anxiety and depression, but is highly effective for chronic pain. It identifies and dismantles vicious cycles, where negative thoughts lead to anxiety, which leads to avoidance behaviors, resulting in decreased function and chronic pain. CBT intervenes through cognitive restructuring, examining extreme thoughts and reconstructing them into flexible thinking and behavioral activation, reducing avoidance and gradually resuming activity to build successful experiences. Exercise therapy isn't about building strength, but teaching your brain that movement is safe. This approach, called pain reprocessing, uses successful exercise experiences to re-educate the brain. Graded exposure breaks avoided movements into small steps implemented, gradually reducing fear and normalizing behavior. Combining CBT with pain neuroscience education, which explains why the brain feels pain hypersensitively and why movement doesn't cause damage, is well established. Studies show CBT reduces pain intensity, expands functional capacity, improves depression and anxiety, and increases self-efficacy. The goal isn't ending treatment in the clinic, but applying principles to daily life, combining movements with reassuring self-talk and small successes, replaces brain danger memories with safety memories. Chronic lower back pain can no longer be explained solely by muscle or bone problems. Even when scans show no abnormalities, the pain patients feel is real. It's the brain's neural circuits having learned pain as a perception. Pain is learned, which means pain can be relearned. This brings true hope. Through education providing correct understanding of pain mechanisms, cognitive behavioral therapy, bringing distorted thinking back to reality, and relearning-based exercise therapy, overcoming fear. Patients can confirm through their own bodies that movement doesn't cause damage. These safe experiences rewrite pain memories and regain freedom. If you're afraid to move because of pain, please remember your body isn't broken. Your brain is just being overprotective. The brain can change, behavior can change, and pain will surely change too. Please subscribe to our channel and hit the like button. Thank you for watching.